So please welcome, with a big hand, Dr. Gabor Maté. The first thing I wanted to talk about is the title of your book, Myth of Normal.
Yeah.
Do you want to explain why you called it that?
Sure. So, in the introduction, we quote the great American writer David Foster Wallace, who himself was quite a story and committed suicide. His most famous book is called Infinite Jest, and he was giving an address at a commencement ceremony at some university, and he tells the story of these two young fish swimming along, and along comes an older fish of the same species, and says to these two younger ones, "Hey boys, good morning boys, how's the water?" And the two of them swim on for a while, and then one of them turns to the other one and says, "What the hell is water?" Meaning that when we're so used to something, we don't even see it. And as a physician, I'm taught that human life is possible within a normal range, which is true. Certain blood acidity, above it or below it, you're dead. Body temperature, above it, below it, you're dead. Blood pressure, above it, below it, you can't live. So what is normal is equated with what is healthy and natural. But in this society, we make the assumption that what we used to, like the water, what is considered to be normal, is also healthy and natural. And what I'm saying is that what we consider to be normal in our culture is neither healthy nor natural. So if you look at the rising tide of overdose deaths or mental health conditions, depression, anxiety, ADHD, whatever, we can either look at these conditions as somehow genetically driven biological entities for who knows what reason they're going up, or we can see them as responses to an environment that doesn't sustain human life in the way human life is meant to be according to nature. So that what is normal here is neither healthy or natural. As a matter of fact, I mean, if I can give an example, the first book I wrote was Scattered Minds on ADHD, which 24 years after its publication finally became a New York Times bestseller this year. But when I was diagnosed in my mid-50s, the general idea was, and still is, that this is this inherited biological brain disorder. And I was diagnosed because I recognized myself in it, and within a couple of months, so were two of my kids. So it must be genetic. So my intuition told me that that's not right. And when I thought about the hallmark of ADHD, which incidentally is a major risk factor for addiction, it's the tuning out, the absent-mindedness. And I thought to myself, well, what is tuning out? What is absent-mindedness? It's a coping mechanism. If I were to stress you right now, you'd have three healthy responses, three natural responses. One is to ask for help. That's the first one. That's what babies do. They're in trouble, they ask for help. Or, if it's available, you can escape or fight back, flight or fight. But what if you can't do any of that? Then what the human brain does is it tunes out. It absents itself. It disconnects. It dissociates. And when I thought of my own infancy, as a Jewish infant under the Nazi occupation in Hungary, I don't have to go into the whole details of it, but you can imagine what year I had, and my mother was in terror and in grief, and when the mother is stressed, the baby is stressed. It's that simple. How does the infant deal with it? They tune out. What I didn't know, because nobody in medical school taught me this, but I found out soon after, is that the brain develops an interaction with the environment. And so that the most important aspect of the environment that shapes the very circuitry of the brain, including the dopamine and endorphin receptors and all these circuits, is the emotional relationship with the caregiving adults. So, plug me back into my childhood, my infancy. Jewish infant, Second World War, Nazi occupation, genocide, a stressed, terrorized mother, a stressed baby. What does this baby do? Tunes out. When? When his brain is developing. So that gets wired into the brain. 55 years later, you got this genetic brain disease. The hell I do. I've got a coping mechanism that was wired into my brain. Why do my kids have it? Because they grew up with parents who were traumatized, hadn't worked with that trauma just yet, didn't even know they were traumatized until later. And so they grew up in a very stressed environment as well. This is how we pass it on. So what I'm saying here is, by way of a long answer to your question, is that tuning out and that ADHD is a normal response to an abnormal situation. And this is my same contention for a lot of physical illnesses, what we call mental illnesses, depression, anxiety, and so on. These are all normal responses to abnormal circumstances, which means that the people that we call abnormal are very normal. What wasn't normal is what they had to face. They were never helpless. So that's the meaning of the title of the book.
Yeah, I feel like a lot of the things that you said I so relate to, because I grew up in a home with lots of violence, a lot of abuse. My dad was a misogynist, and my mother was, a helpless victim who didn't feel like she could leave him because she didn't have any education or any way to support kids on her own, so she stayed. And so I grew up in this very traumatizing household, and then I grew up to perpetrate the same thing on my children because I didn't heal my trauma before I had kids. And I had ADD as a child. I was always in trouble at school because of my ADD. I actually was traumatized by my ADD because in my elementary school, I would get, they called my parents in and set up said your kid has this problem. And so they would give me a pink slip, a red slip, or a black slip every day. And if I got a black slip, I got the belt when I got home. And I got a black slip almost every day because I couldn't control my ADD. And so then, anyways, I grew up, didn't heal my trauma, had children, passed that trauma down to my children. Both my children have ADD,
and
among other things.
And so it is transgenerational, but it's not genetic. No. There may be something genetic, by the way, about a lot of mental health conditions, including ADHD, but the conditions are not genetic. What is genetic, and nobody's ever identified one single gene that if you got this gene, you're going to have a certain mental health condition, or any group of genes that if you have this group of genes, you're going to have this certain mental health conditions. What they've identified with is a large group of genes. The more of them you have, the more likely you are to have any mental health condition. But you can have those same genes and not have any mental health condition whatsoever. So what are these genes for? In fact, I'll tell you in a minute. So there was a study in, I think, Australia and New Zealand where they looked at aggression, violence. And the most violent people had a certain set of genes shared by the least violent people. So the gene wasn't for violence. Is for sensitivity. The more sensitive you are, the more you're going to be affected by the environment. When the environment is stressed or traumatic, you're going to be that much more affected. When the environment is great and supportive, you're going to be that much more affected. So if you get the same genes in a healthy environment, those people will just be creative and intuitive and empathic and leaders and shamans and so on. In a negative environment, those are the ones who suffer the most. And there's just one more thing I'll say here, which is that a lot of you are working in the mental health field. We think that mental health diagnoses explain things. No, they don't. They're totally circular. And I talk about this in the myth of normal. I've been diagnosed and treated for 2 mental health conditions, personally. Depression and ADHD. So let's take depression. Gabor has depression. How do we know? Because his mood is low, his affect is flat, and he socially isolates. Why is his mood low? Why is his affect flat? And why does he isolate? Because he's depressed. How do we know he's depressed? Gabor has ADHD. How do we know? He tunes out and has poor impulse control. Why does he tune out and have impulse control? He's got ADHD. Meaningless, gibberish.
Right.
Now, the diagnosis they describe things, and that could be helpful. When you describe something, at least you got some kind of a handle. But never mistake a diagnosis for an explanation. The explanation has to do with what happened to this person. And Oprah, the book that Oprah wrote with the wonderful psychiatrist Bruce Perry, What Happened to You? So basically, each diagnosis begs the question, what happened to you? That's what explains it, not the diagnosis.
Yeah, so you were mentioning highly sensitive people. So there's a gene for high sensitivity.
There's several genes.
So do you think that the very highly sensitive people, they're born with the more ability to be traumatized?
They're more affected by the environment. Now let me just hold out your hand for a minute, okay? I don't hit you, okay? How much did that hurt?
0.
Right. Now imagine there's a burn there.
Yeah.
So that the skin is sloughed off. So your nerve endings are close to the surface, which means you're thin-skinned. Now I tap you with the same force. What do you feel?
More pain.
Severe pain.
Yeah.
Even though the external event was no different.
Is the same, right?
So there is such a thing as sensitivity. Now, the more terrible things happen, the more it's going to affect you, whether you're sensitive or not. But if you're sensitive, it's going to be that much more.
And so even if two people grew up in the same household, one can be more sensitive than the other,
they'll be affected differently.
Yeah.
Number one. Number two, no two people live in the same household.
Oh.
No two children have the same parents. Number one, the British psychiatrist D.W. Winnicott said that even if a mother could be the same mother to all 8 of her kids, which she can't be, they would still have 8 different mothers because they have 8 different temperaments through which they experience that mother. Number one. Number two, we're not the same. We may love all our kids the same way, but we don't relate to them the same way. One is an oldest child. The older child gets treated differently than the youngest child. Not for favoritism, just the parents relate to them differently. They're at a different stage of their lives. Maybe their traumas are more apparent at one point. Maybe they're under different economic circumstances. Maybe their relationship is in a different phase. That means those kids are experiencing different parents.
Yeah.
And not only that, each child evokes from the parent a different response. I've had identical twins treated totally differently by the same mother. I was there at the delivery, and one of them came out 5 minutes earlier and a pound heavier. The mother always had a sense of guilt towards the younger one, that somehow he'd been pushed aside in the womb and he was more fragile. And so when he spoke to him, when she spoke to him or about him, there was also kind of an anxious tenderness in her voice. Whereas the robust, bigger one got a different, more confident mother.
Yeah.
They didn't have the same mother. And if you look at the brains of identical twins, they don't look the same.
And especially if there's years in between. So
if there's what?
Years in between.
Yeah.
Like you have one child,
yeah.
and then 4
yeah.
years later you have another child. You're going to be in a different stage of your life. And
yeah, and you know, the oldest child does have the benefit of being the only one. On the other hand, also the burden of untried and unpracticed parents. So it's all different. And then the oldest child suffers the indignity of having the enemy coming to the home, you know, like I did. You know, it took me 40 years to forgive my brother for being born, you know. Anyways, nobody has the same household. That's the point.
So let's talk about trauma.
Yeah.
I love your definition of trauma. Will you share that with everyone?
Sure. So first of all, just look at the word itself. And it's one of these words that it's both overused and underused. It's overused in this sense that people use it rather promiscuously, rather loosely. I organized a picnic yesterday and had beautiful food, and then it rained, and I was traumatized. No, you weren't. You were just disappointed. All right, I had this date, and she didn't show up, and I was traumatized. No, you weren't. You were just upset. So every trauma, as Peter Levine points out, everything traumatic is stressful and painful, but not every pain or stress is traumatic. Trauma means a wound. So if you're wounded in a way that persists, that's a trauma. That's just simply what a trauma is. Now, trauma, which means also that trauma is not what happens to you. So trauma is not the sexual abuse. Trauma is not the physical abuse. It's not the death of your parent. It's not whatever happened. Trauma is what happened inside you as a result of what happened to you. So trauma is the wound that you sustain. Those are the traumatic events, but the trauma is what happened inside you and what you're still carrying, which is a good thing. Because as I've often said, if the trauma was that my mother gave me to a total stranger when I was 11 months old, which she did, if that was the trauma, it's finished, it's over, it happened. It'll never not have happened. But if the trauma was that as a result, I decided that I can't trust, or I decided that I wasn't lovable, that's why I was given away, that can be healed anytime. So trauma is the wound that we're carrying. And the only thing, where it's not used nearly enough, of course, is where it should be. The average medical doctor doesn't get a single lecture on trauma, which is unbelievable. But it's true in almost every medical school in North America, which is incredible because you can documentably show that trauma is at the basis of all mental health conditions, all addictions, a lot of autoimmune disease, and so on. Not as the single cause, but as a major contributing factor. And yet they don't talk about it. A lot of psychologists can graduate with their PhD in hand and not know anything about trauma. Let me tell you a story about San Diego. I'll tell you two stories about San Diego. You all heard about the adverse childhood experiences studies, the ACE studies?
Who's heard of that? The ACEs study. Okay, most
Oh my
people.
God, even in this crowd, not everybody has heard about it? All right. The adverse childhood experiences studies, the ACE studies, were initiated here in San Diego. Dr. Vincent Felitti, a recently retired internal medicine specialist, was working in an obesity clinic where they found that with rigorous dietary control and behavior mod, they could get people to lose weight. What do you think they couldn't do? Get them to keep it off. And so Vince did something extraordinary for a medical doctor. He started listening to his patients. And they said, don't we get it? Don't you get it? We're stuffing down our pain with the food. That's the basis of everything. So Vince, along with others, did this major study. They looked at 17,000 people here in California, most of them Caucasians, 50% of them were so university graduates. And they looked at two factors. One is childhood adverse experiences, ACEs, adverse childhood experiences, which included physical, sexual, emotional abuse, that's 3. A parent dying, a parent mentally ill, a parent being jailed, a parent being addicted, violence in the family, a rancorous divorce or neglect, that's 10 of them. For each of these adverse childhood experiences, the risk of addiction, including to food, but to substances, went up exponentially. By the time a male child had said 6 of these, his risk of being an injection-using substance addict is 4,600% greater, 46-fold. Kind of correlations you never see. So these studies were published. Now, Vince was working in the Kaiser Permanente system. That's where they did these studies. So 2 stories about San Diego. One is I was invited to come to San Diego to give a talk, not actually to Sacramento, I should say, to give a talk on addiction after my book on addiction came out. And great, to addiction doctors and therapists and nurses and so on. I said, sure, great. A month before I was to come to the talk, I get a phone call or an email saying, do you have any documented evidence for the relationship between trauma and addiction? I said, yes, I do. And this was to Kaiser. No, I should tell you, the organizers worked for Kaiser Permanente. And they were inviting me to speak to Kaiser doctors. Do you have any documentation? I said, yes. The adverse childhood experiences done in Kaiser Permanente. That's one story.
That's pretty sad.
That's one story. The other story is I was in Norway at an addiction conference. There were 2 other main speakers who didn't know me from a hole in the ground, which is fine. One of them, I'm not going to mention his name because he lives here, but he's one of the editors of one of the editions of the DSM. Very well known author, physician, psychiatrist, so on and so forth. This task force and that task force. That's one person. The other person was as high up in the not dialectical behavior therapy, cognitive behavioral therapy, as you can get. CBT. And the night before the conference, the 3 of us are having dinner at the host's home. And I said to the psychiatrist, so where do you live anyway? He says, oh, San Diego. I said, oh, you must know Vince Felitti, Dr. Vincent Felitti. They both said, who's that? I said, oh, well, he's just the lead investigator in some of the most important studies ever done when it comes to addiction and mental health. The adverse childhood experiences studies. They both said, what are those? I mean, it's freaking unbelievable. And so when I say that, on the one hand, it's used promiscuously, on the other hand, it's not used enough. I mean, where it really matters, law. I mean, what if we understood trauma? What would we be doing with our jails? Education. Instead of punishing kids, it would be supporting them and helping them. Medicine, of course. Psychology. In those areas, we don't talk about it. Let me just say one final thing. Trauma doesn't have to be terrible things happening to you. Kids can be wounded by bad things that happen to them, but they can also be wounded by the good things that should happen not happening. So we can talk about the big T traumatic events, those adverse childhood experiences that I mentioned, to which we should add racism and poverty, social factors. But then kids can also be traumatized in the small T sense of their needs not being met. And believe me, human children can be wounded deeply, especially if they're highly sensitive, just by their needs, certain needs that they're born with not being met. And that's almost universal in this culture, which is why I call it a toxic culture.
Yeah, and there's a lot of good things in your book about these types of things, about raising children.
Yeah.
If you have kids, you're raising kids, you got to read his book. It's profound. I wish I would have had it when I was raising my kids.
So do I.
Yeah. Right? Exactly.
As a matter of fact, even now, sometimes, I get people coming up to me saying, oh, I read your book and it changed my life. And my response is, maybe I should read it myself,
So another type of trauma that you mentioned in your book that I had never really thought about before I read your book was trauma that happens in the womb.
Yeah. Oh, yeah. So there's a quote I can recite almost by heart now because I've cited it so often. It's from an obscure academic publication, nobody's ever heard of it, called Pediatrics, which is the official journal of the American Pediatric Academy, the official journal of making pediatricians. Okay, so no wonder nobody's ever heard about it, because it only appeared in a major journal, and it's from an obscure little institution called Harvard University. Which nobody's ever heard of that. So how should anybody know about this article? But the article was published in February. If you notice, I'm pretty arrogant, you know. The article appeared in February 2012 from the Harvard Center on the Developing Child in the Journal of Pediatrics. The average doctor never read this article, wouldn't have a clue what I'm talking about. But the article said that the architecture of the brain is constructed to an ongoing process that begins before birth and continues into adulthood, and forms either a fragile or a sturdy foundation for all the health, learning, and behavior that follow. Not some of the health, all the health, learning, kids with learning disorders, behavior that follows. That's the first sentence. And the second sentence says that the interactions of gene experiences literally forms the circuitry of the developing brain and is heavily influenced by the mutual responsiveness of adult-child relationships, particularly in the early childhood years. So what do those two sentences mean? First of all, the brain begins to develop before birth, which means that the prevention of addiction, you know what it needs to begin? At the first prenatal visit. Because stresses on the mother already affect the child's brain. This is not even vaguely controversial. We know this from all kinds of studies. So that women who are stressed, for example, will have higher levels of cortisol and adrenaline going through the placenta to the baby. That's going to affect the child's brain development. Mm-hmm. Those children are at higher risk. I could cite you many studies, and there's a whole chapter on this in the Myth of Normal. Now, when you go to medical school and you're taught prenatal care, you learn to take the blood pressure and the weight and measure the growth of the uterus, make sure that it's appropriate, listen to the baby's heart sounds, do blood tests, ultrasounds. Nobody ever says, ask the woman how you're feeling emotionally. What's your relationship like with the father of your child? How do you feel about your work? What is your mood like? How much support? Nobody's taught to ask these questions. But they already bear on the child's brain development.
Yeah.
So it's that simple. And not to mention then how we give birth, which is, I could go on. The cesarean section rate should be about 10 or 15% because it's an essential life-saving intervention. 10 or 15% of the time. The cesarean section rate in many places now is approaching 50%, and even higher, which means we're interfering with a natural process which is designed by nature to promote bonding between mother and infant, hormonally and physiologically and in other ways. So that how we look after pregnant women, how we birth, huge impacts already on the developing brain of the child. We don't even think about these things. And this is why it gets so frustrating and even, well, I won't use harsher words. Let's just say frustrating. This is pure science. It's not even vaguely controversial. And the average doctor never hears about it.
So, talking about stress on the mother, I think that when I was going through my own pregnancy, the first one I had, a doting father taking care of me, making sure I was comfortable, doing everything for me. And then my second child was a traumatic relationship. It was an abusive relationship, and I was stressed the whole time. Yeah. And so, there were so many different factors to why my children are traumatized. It could be so many different things. I don't think you can even figure it out because there were so many things. But that was definitely one of them.
Yeah. Yeah. And my wife. In the Myth of Normal, this book on prenatal life begins with an excerpt from a diary that my wife kept. And she was writing to a child she was carrying. This is her third child. Saying that, dear child, this cortisol and adrenaline that you're experiencing is not because of you. It's because of my relationship with your father, who was me. And I was a workaholic doctor, hostile to my wife. And that child experienced it. Well, thank God, she's doing just fine. But she's had lots of challenges. I've said to my kids, I screwed you up, I pay for your therapy, you know. And but
Me too.
But we've had to do a lot of remedial parenting when our kids were older because of things we didn't know about, weren't conscious of, couldn't help when our kids were small.
Let's talk about your chapter 23, why women have it worse and why chronic illness and chronic disease affect women at a higher rate.
Yeah. So if you look at autoimmune conditions are when the immune system, which is meant to protect the body, actually turns against the organism. So that in rheumatoid arthritis, you form antibodies against your connective tissues. So your immune system is attacking your joints. So now you have pain and inflammation and erosion and so on. In other autoimmune conditions, like multiple sclerosis, the immune system will attack the nervous system. Now you have paralysis or blindness or weakness or trembling or numbness or whatever. Now 80-90% of autoimmune conditions happen to women. 70 to 80% happen to women. This is a big mystery. Why? Well, you may not want to put your hand up, but let me just ask you. Anybody here with autoimmune conditions? You? Let me tell you about you. You're a very nice person. You tend to take care of other people's emotional needs before your own. You have difficulty being angry in a healthy way, to set your boundaries. You have two fatal beliefs. One of them is that you're responsible for other people feel, and you must never disappoint anybody. Now, I've never had anybody with autoimmune conditions, MS, rheumatoid arthritis, lupus, fibromyalgia, chronic fatigue, Crohn's, colitis, whatever, without those features. These features nobody's born with. They're not you. They're your personality that you adopted as a child. Because when you were a child, your parents couldn't take care of your emotional needs. You ended up taking care of theirs by suppressing your own needs. Because from the physiological point of view, the mind and the body are inseparable. I mean, it's not like the immune system, the hormonal apparatus, the nervous system, and the emotional apparatus is one system. They're not separate. It's one. When you're suppressing one aspect of it, for example, healthy anger, you're also suppressing another aspect, which is the immune system. Let me give you an example. If I were to transgress a boundary with you right now, whether physically or emotionally, if I just intruded on your space, a healthy response would be healthy anger. No, my space, get out. So healthy anger is nothing but a boundary defense. Nature gave us the circuitry in our brain for anger, just as we have circuitry for play and for love and caring and fear and grief and lust and curiosity. We also have circuitry for anger, which we share with other mammals, by the way. It's necessary. Now, so the role of the emotional system is twofold. One is, actually, it's a boundary. It lets in influences that are healthy and welcome and nurturing, like a loving connection you'll welcome and allow in, but a toxic or dangerous one, no, in my space, get out. That's the role of the emotional system, to set a boundary. Let in what is healthy, keep out what is dangerous. Trick question for you all. What is the role of the immune system? Really difficult. It's the same damn thing. Keep out what's toxic and dangerous. Let in what's healthy and welcome. Now, they're one system. When in childhood, you had to suppress your emotions, and then that became your pattern, and you're doing it all your life, and you're looking after others' needs, ignoring your own, you're affecting your immune system, which then turns against you. Why do women have much more chronic illness in this society? Because between those two genders, which is the one that's culturally programmed to absorb the stresses of everybody else, to repress their healthy anger, to look after other people's emotional needs and not their own, and never to disappoint anybody. It's culturally determined. There was a study out of Massachusetts. They looked at 2,000 women over a 10-year period. Those women that were unhappily married and didn't express their feelings were 4 times as likely to die as those women who were unhappily married and did express their emotions, because of the impact on the immune system and the heart and so on. That's why women have it worse in that sense.
Yeah, and another part of your book, you talk about when the body says no.
Yeah.
And I wrote down some of the things, like if you're experiencing insomnia, back pain, abdominal pain, digestive issues, frequent colds, fatigue, headaches, skin rashes, muscle spasms, or suffering from overeating, you might want to ask yourself, what are you not saying no to?
Yeah, well, that's the title of a previous book of mine. Is called When the Body Says No.
Yeah.
And look, I worked in family practice for 22 years before I did 12 years of addiction medicine. And then I was also the coordinator of a palliative care unit looking after terminally ill people. So I had a chance to see who got sick and who didn't. And it's these people with these characteristics. They didn't know how to say no. I'm just looking at, let me tell you a story, okay? When I was researching When the Body Says No, but before I had done the research, let me track back a bit more. There was a book written 12 years ago by an Australian palliative care nurse called The Top 5 Regrets of Dying People. And like her, she worked in palliative care, looking after dying people. You know what and then these people who died before their time. You know what the top regret of these people was? That they weren't themselves. They spent their whole life trying to please other people. They suppressed their true selves. And that's what I saw in the people that got sick as well. So, word got around Vancouver, where I lived, that I was researching this book, and I was invited by a group of, a self-support group of people with multiple sclerosis. Now, MS became the second chapter of When the Body Says No. I'll tell you why. Because these group of people invited me. There's about 25 of them. And I said, listen, I'm so sorry if I'm going to insult you. I don't mean to demean anybody. I'm just giving you my vague impressions. I haven't done the research yet, so I don't know if what I'm saying is true or not. But I think my clinical experience is that the people who get MS, and then I gave these characteristics that I listed for you. Then I waited for the pushback. And they said, you just described our lives. So out of the 25, 22 volunteered to be in my book. They couldn't say no. So but there's a woman there who said, I can't say no. I can't say it. I said, terrific. Give me $100 right now. And she said, I don't have $100. I said, not a problem. There's a bank outside the building. After this meeting, we'll go to the ATM machine. You'll take out the $100. You give it to me. She said, I don't think that would work for me. I said, look, I'm just trying to get you to say no to a perfectly ridiculous demand by an utter stranger to whom you owe nothing whatsoever. She says, I can't do it. No, not her fault. Not her fault. How many parents are in the room? All right. What's the word your kids start saying relentlessly at age 1.5? No. Nature programmed us to do that. Because that no is the child's boundary behind which they can develop their own sense of self. And before we know how to say yes, we have to say no. If we don't know how to say no, your yeses don't mean a thing. If I come to San Diego and if I phone Kay up and say, Kay, can we have coffee? But you've been up all night with one of your clients and you're tired and you're sleepy and you don't feel like it. And if you don't say no, what's going to be impact on you? You're going to be more tired, more stressed and resentful. But you're going to say yes because you don't know how to say no, because you're afraid that if if I say no to Gabor, he won't like me or something like that,
How much time do you have?
Then your yes doesn't mean a thing. If I call you up and say, can we have coffee? And you say yes, but you don't know how to say no, it doesn't mean you want to be with me even. It just means that you don't know how to set a boundary. So that no is really important. And the people that don't know how to say it, they get chronically ill. And now in Western medicine, again, we're trained just to try and get rid of symptoms. So if you come to me with stomach ache or back spasms or frequent colds, dry mouth, sleeplessness, did I say fatigue? Whatever it is, migraines, you just want me to take your symptom away, and me, the doctor, just wants to give you a prescription to get rid of the symptoms. Well, that's all right, but what if we also said, what is your body saying that you're not listening to? Because in almost every case, your body's talking to you. But we've disconnected from our bodies, which I'll prove to you. Let me ask you a question. If you've had the experience of having a strong gut feeling about something, but then you ignored it, and you were sorry afterwards, just raise your hands. Almost everybody. No, you just told me the story of your childhood. Because I got news for you. When you were born, you knew how to pay attention to your gut feelings. In fact, you didn't know anything else. At some point you learned that if I'm authentic, and I talk about this in the Myth of Normal as well, if I'm authentic, they won't like me. I better disconnect. So that we choose belonging and liked and acceptance, attachment over authenticity if we're plunged into that tragic choice. And then we grow up disconnected from ourselves, not knowing who we are, and finding ourselves behaving in ways that are compliant, but completely foreign to who we are. It's that simple.
Yeah, that was the next thing I was going to bring up is attachment versus authenticity.
Yeah.
Because I think that was one of the, definite huge lessons in my life when I was suppressing my authenticity in favor of staying attached to this unhealthy, toxic relationship.
That's right.
Everything was a mess. My health was horrible. I had chronic issues. I had degenerative disc disease in my back, sciatica. I had chronic migraines, like 3 or 4 a week.
Yeah.
And I was going through all that, and I was suppressing my authenticity. I didn't even know who I was. I didn't even do that self-inquiry at all. So,
well, which is okay, because who'd ever taught you? But which is not okay is this. You probably went to a lot of doctors.
oh, definitely.
Did anybody ever ask you about any of this stuff?
Mm-mm.
That's the problem.
No, they just told me I would need surgery.
Yeah. And it's not like this is pure, I'm giving you pure science. That's what's so hard to get across. It's not just my impressions or the impressions of other people. It's been studied and overstudied and shown, and the physiological pathways have been delineated, and the average doctor doesn't have a clue. And it's not their fault. It's just this society that separates the mind from the body and the individual from the environment. And of course it has to, because if this society recognized the sacred unity of mind and body and individual of the environment, would we raise kids the way we're raising kids? Would we treat people like the way we treat people? So that when profit is the ruler, you have to disconnect mind from the body and the individual from the environment. So, any wonder that women of color have more autoimmune disease, indigenous women in Canada who didn't used to have any rheumatoid arthritis whatsoever prior to colonization now have 6 times the rate of rheumatoid arthritis than anybody else. The black women in the States, the more experience of racism they have to endure, the higher the risk for asthma. I could go on and on and on. Now, if we recognized all these unities, we couldn't have the system that we have. So that the separation of mind from body isn't just an error, it's an imperative of the system.
So is you talk about toxic culture, and I feel like it's definitely highly affects me, the toxic culture. There's so many things that are so concerning, and I know that everybody gets that. And we're basically swimming in a toxic culture and, surrounded by traumatized people.
Yeah.
And so how do we survive in that? What is the hope that we can do to try to, either maybe change our worldview is one of the things that you talk about in your book, that we need to change our worldview because if we change the way that we view the world, then the world we view will change.
Exactly. Well, this is an age-old question. It didn't begin with this particular social economic system. It goes back to our separation from nature and becoming quote-unquote civilized a long, long time ago. And this issue of how to be in the world without being of the world. In other words, being in the world but being defined without being defined by the expectations of the world. That's an age-old question that spiritual teachers have been dealing with forever, going back to way before the Buddha, way before Jesus, but as I think you yourself have found, you have to shed the identity that you developed. You developed a certain identity, we all do. Identity from the Latin idem, which is the same, and facere, which means to make. So to identify with something is to make yourself the same as. Mm-hmm. So at some point, you and I both identified ourselves. We thought we were our coping mechanisms, our defensive personality patterns. At a certain point, you have to shed that identity. It's scary because that identity is associated with our survival. Mm-hmm. So that inauthenticity is how we survived. And when something is associated with survival, it's really scary to let go of it.
Yeah.
So we have to shed our identity, and not necessarily. Now, some people do it through they don't do it. For some people, it happens through a sudden and cataclysmic spiritual transformation. I've never had that happen to me. I'm waiting, but I never had that happen to me. Some people have had that experience. Most of us don't. For most of us, it's a gradual process of becoming conscious. And it's not once and for all. It's like toggling back between consciousness and unconsciousness several times a day. But it's a process. So it's shedding identity and discovering who we truly are. And then learning to be in this world without taking on its values and expectations. It's possible to do it. It's also a privilege to do it, and the more downtrodden you are, and the more... But you know what? Let me tell you something. Here in Los Angeles right now, there's an art exhibit. One of the exhibitors is a guy called Obi. Obi lives in a death row prison in Texas. Texas loves killing traumatized young black guys. They just love it. And Obi committed a murder when he was 18 or so. Typical traumatized childhood, gang, drugs, a killing. Now, of course, the state says you have no right to live. Meanwhile, the appeal process goes on. So he lives in this death row, open cages, where regularly they see their friends being carted off to the electric chair. And I've had some messages from these people of gratitude for my work. And Obi has meditated, has had a deep spiritual transformation, loves life, gives as much as he can to young kids so they don't have to go the way that he went, and he's become an artist. So I couldn't go see it because the days that the museum was open on, I was teaching here near LA, but what am I saying? If it's possible, for God's sakes, for a traumatized young guy in a death row prison to find themselves truly and to embrace life fully and to create and to give, then who isn't it possible for? You know, so easy for me to say all that. I have no idea. I'd rather doubt that I'd have in me to do what he did, you know. But you can be in this world and not be defined by it, is what I'm saying.
I think that my, experience of going to rehab and felt like jumping off a cliff into the unknown, didn't know who I was going to be after that. It was kind of a, just surrendering to the unknown. And then I began to figure out, who am I going to be now?
Yeah.
So I kind of gave up who I was instantly. And then I discovered the path of yoga.
Yeah.
And I think you and I discovered it similarly because I heard you talk about it in an interview that you met Sadhguru.
I did.
Yeah, and I did the inner engineering right after I got out of rehab. That was the first thing I did was that, and that brings me to the final. I think we have to wrap up at the 4 A's.
Can I just quickly jump in?
Yeah.
Just about Sadhguru. I did meet him, and it had a very positive impact on me. And I learned his yoga, which I continue to do when I'm disciplined enough. But I'm not a follower of the guy.
Yeah.
Okay, I don't. It's like somebody said to me, Sad means truth, and Guru means guru. Anybody who calls himself the truth guru is not. Okay, so there's a lot of these spiritual teachers out there who teach beautiful stuff, but this stuff I don't particularly. The stuff that I am not comfortable with, especially with hero worship or guru worship.
No, I think it's a personal practice. You have to have your own.
But as a personal practice,
Yeah, you have to
I'm
have your
grateful
own
I met the
practice.
guy, and I'm grateful I learned what I learned.
Yeah, I didn't continue to study with him either. I just took that course, and that opened the path to me. And then I went on my own after that and discovered more and more. But we are out of time. I wanted to talk about the 4 A's: authenticity, agency, anger, and acceptance. But I think, we're going to have you guys read the book. Because I think Gabor wants to answer some questions from the audience, correct? Do we have time for that?
The only thing is, to those 4 A's, I would have added a 5th one, which is, I kind of assumed, but I should have added it, which would have been awareness.
Awareness.
Yeah. I think that's the key, is like the way you become authentic is you become aware of how you're not being authentic, for example.
Yeah.
So I would have added that one.
I think that those 4 things were crucial, and that one too, were crucial in my recovery. Just 100%. That's how I did it. Those were the things, Learning to express my anger healthily, being my authentic self, doing self-inquiry, finding out, who am I? What do I care about? What do I want to do with my life? These questions I had never asked because I was giving my life up to other people instead of being myself. And I think being yourself is, the key. And that's what yoga is. It's a path to self-realization, So that's what we teach here at Villa Kali Ma. We try to help them find themselves, their true self, and then be that authentic person. And agency is one of the A's that Gabor talks about. That is, taking responsibility. Take responsibility for your life. Don't say, oh, well, because this happened to me and this happened to me, so there's just no hope. Instead, you go, yeah, that happened and that happened, but what am I going to do now? The whole world is my oyster. There's so many options. So it's these principles that he talks about, and all of his work was really how I healed. So thank you so much, Gabor. I really appreciate you taking your time and coming all the way down here for this and for me. I really appreciate. So you want to answer a few questions?
Sure, if there are any.
Hi. Thank you for everything that you've done and that you continue to do. I have two questions, if I may. So you've demonstrated the connection between stress and ADHD. I'm curious if there's, or how do you understand or explain neurological disorders like autism? Is there also a connection with stress in that? And then I have a second.
Like autism, you said, and what else?
Autism, yeah.
Okay, all right. So here's the thing. The rate of autism is increasing according to everybody. There's only a number of potential explanations. One is genuinely it's going up. Number two, we're overdoing diagnosing it. We're calling it all kinds of things autism that we didn't used to call autism. Or that we're just better at recognizing it than we used to be. But my impression is, as a clinician, and a lot of clinicians and educators, there are many more kids with those issues than there used to be. So let's assume that even if we're better at diagnosing and even if we're overdiagnosing, there's still more kids who meet some of those characteristics. What's it all about? This is a difficult one, but there's some. I'll tell you what I believe. But contrary to everything else I've said today, which I can stand behind, this one is a conjecture, with some research behind it, but not enough. I think something happens during pregnancy. I think it has to do with stress on women during pregnancy and highly sensitive children. Neurologically sensitive children whose mothers are stressed. I'm not blaming mothers. Nobody chooses to be stressed. It's this culture that stresses people. I think it has to do with prenatal factors. And there's some evidence for that. That women who are stressed or women who are ill, they're more likely to have kids who are autistic. But it's far from conclusive. But that's just what I believe. Okay?
Thank you. Is it possible to ask one more question?
You just did. You asked me if it was possible. Well, it would be if they gave you the mic, but.
Hi.
Hi. Sorry, where are you?
I'm over here.
there. Yeah. Hi.
You were talking at the beginning about these symptoms that people have, and and then they're labeled as they have depression. And what do you feel about these labels? What do they actually do to people when they get these diagnoses? Especially what we see here at this center is, I feel like some of them just they get the clients get like attached to that, and it kind of like portrays their future for them in a negative way.
Yeah. It very much depends on who uses them and with what intention and with what awareness. So look, I was in my 40s when I was diagnosed with depression, and I was given antidepressants. It really helped. Within 3 days, I was a different person. That's a whole other conversation, because then you could say that, depression is a biological disease caused by lack of serotonin. No, it isn't. But in fact, what does it mean to depress something? It means to push it down. What are you pushing down in depression? Your emotions. Why are you pushing them down? Because you couldn't express them when you were a kid. And that affects your brain. But it was helpful, because it seemed to provide an explanation. Now I got a handle on something. Or ADHD is the same thing. It seemed to provide an explanation. And I've always wanted to write books, but literally until I understood my own ADHD, I couldn't have written my first book, which was on ADHD. My brain, I couldn't have done it. I took medication when I wrote the first book. With this most recent book, which is much more complex, much longer, I tried to take medication in the beginning thinking, okay, maybe the dextrodine, which I hadn't taken for years, will help me focus better and write this book. All it did is give me side effects. I hated it. I stopped after one day. And I wrote the book without medications whatsoever. So those diagnoses can help, because it's kind of a relief to realize that there's some kind of an explanation, that you're not uniquely screwed up. You know, there's a pattern here which has been described and other people experience it. That could be empowering up to a certain point. But if you identify with it, like sometimes people say, I am ADHD. I am. Oh, nobody is ADHD. In fact, nobody even has ADHD. It's not a thing that you have. It's a process. All mental health conditions, all physical health conditions, they're not things that you have. They are processes in an organism. They're dynamic processes that are responsive to life conditions, experiences, consciousness, and so on. So if we can take these diagnoses as snapshots of a person at a certain point in life, but that snapshot, any more than a snapshot of yourself at a certain point, didn't represent your dynamic process. It just represented where you're at a certain time for certain reasons, and that you can have agency in where you go from there, then they can be helpful. But if we take them as limited descriptions of a person's capacities, they're poison. So it just depends who uses them and with what understanding.
Yeah, and I think that getting a diagnosis and then getting told by a doctor, which you trust, that now you have to take this medication for the rest of your life, is more like a life sentence, you know?
It's a limitation. I
So-
tell you something. I don't have the capacity to do it, but on my laptop, in fact, on my cell phone, I could show you 4 pictures. This is a woman I met 5 years ago in London. I gave a talk on my book, When the Body Says No. She was diagnosed with something called lupus, systemic lupus, which is an autoimmune disease. Mostly women get it. 80-90% of the people with lupus are women. She was told, you got this disease, we have no idea what causes it, we can't cure it, you'll be on medication for the rest of your life, it's going to get worse. So, a year ago she sent me a bunch of photographs. Because she heard that lecture of mine, she went to work on her trauma, learned how to say no, getting authentic, agency, all the stuff. She sent me photographs a year ago. The first 2 photographs are her face. She's got this red rash on it and this bridge across the nose. It's called the butterfly rash. It's typical of lupus. And she sent me a photograph of her fingers, which are yellow as chalk because there's no blood supply to the tips of her fingers. So these fingers are like yellow-white. That was 5 years ago. Now her face is pink, beautiful as anything. Her fingers are suffused, they're just like mine or yours or anybody else's. She's on no medication, there's no lupus, there's no nothing, because she went through this transformational process. So that lupus at that time, that was a snapshot of where she was at because of stuff that happened before. But it did not define where she was going to go. The doctors thought it did, but she chose otherwise.
And that's the option that we have with agency, is to do your own research, don't trust everything your doctor tells you, and read books like Lisa Rankin. She's a doctor who healed herself from chronic illness that was told incurable. She has some TED Talks that you can watch as well. Those are amazing. The Biology of Belief by Bruce Lipton.
Yeah.
You know, be careful what you decide to believe in, because if you decide to believe it, then it becomes true for you. So, you know, question that, question those things. We have time for one more question. All right.
so many of the stories of the people in your book who you interviewed had this inner knowing that they had other choices for their healing. How do you recommend we as therapists and practitioners and healers work with people who don't have that inner knowing, who come to you for your expertise, yet are still very much stuck in the myth?
Yeah. So the therapeutic method that I've helped to develop is called compassionate inquiry. It's a certain way of asking questions. And to somebody like that, I would say, look, there's two assumptions we can make. One is whatever's happening to you, there's no reason for it. You inherited it genetically, you're stuck with it. That's one assumption. We can make another assumption, that whatever you're experiencing, the symptoms that are bothering you, they represent normal responses to stuff that may have happened to you. And you can change them. Are you willing to consider that possibility? Now, as long as you're not trying to force this on anybody and coerce them or even influence them into believing you, but you're just asking an open-ended question, a lot of people will say, well, yeah, I'd be willing to look at that, you know, and or a mother comes to you with a child with ADHD. What would you rather assume? That your child with a genetic brain condition that they're stuck with, and all you can do is medicate it and maybe hope that you can change their behaviors a bit? Or that maybe there were stresses in your sensitized child that you didn't mean to impose on them, but because of stuff that you couldn't help, and you know, the family stress that this sensitive child was picking up on. And if we change the environment, this child's brain can develop in different ways. Which hypothesis would you rather work with? A lot of parents will say, well, I'd like to explore that other one. So there's a way of asking these questions that isn't threatening, and that's the key. That when you talk to people, they got to feel safe with you. They're not going to be judged, they're not going to be influenced. Yeah, well, it is a tricky one, and we have to really watch it in ourselves. If there's a desire in me to influence somebody, I got to deal with it. It's my problem, not theirs. And that's when I train people in compassionate inquiry. We spend the first 3 months working on ourselves. Yeah, so that's the key, is how you approach, how much safety is there for that patient to be really free when they interact with you. Okay?
So Compassionate Inquiry has a certification program that people can sign up for?
It exists in a number of forms. One is a year-long training program. Somebody here has taken it. Oh, you have? Oh, and how's it for you? Yeah, well, yeah. You tell me the honest. Tell them how good it is. No, I mean, no. Give me your honest response.
Yeah, it's a lot.
Yeah.
Yes, and at this current moment, since I'm just a couple months out, I feel very over-therapized, if that's a word.
Yeah.
So it's a lot of inner work, which I'm super grateful for, and also it just is a lot, and it's exhausting.
Yeah.
And at the same time, it's really necessary. I think for anybody who does any kind of talk therapy with anyone to understand a somatic and also just that inquiry of just asking.
Yeah.
And it takes the pressure off completely of the helper to just be curious.
Yeah.
And so it's been really amazing. And
well, thank you. I mean, and thank you. And you said what I was going to say. It's not for the faint-hearted.
no.
I mean, it's demanding of time, of energy, and of self-energy. You know, it's a year-long program. it is time-consuming, energy-consuming. Most people find, we've had about 3,500 students in 80 countries in the last 3 or 4 years. So it's online, but it's live, it's interactive. Again, very demanding. Don't do it unless you're ready. And people think, I'm going to learn this interesting technique. No, you're not. You're going to learn yourself, is what you're going to learn for the first 3 months anyway and throughout. It's also highly rewarding for most participants. It's year-long. Now, there's a short course of CI, and the next cohort is, we do it February, May, and September. We take cohorts. You can load it up online. There's a short course that you can get, which is much less expensive, not interactive, not as time-demanding, but you still get a lot from it. It's just modules that you study yourself. So those are the 2 ways that people can check that one out. You can just look up Compassionate Inquiry online, and you can find links to both the professional training and also the short course.
All right, well, we're way over, so let's give Dr. Gabor Maté a great hand. Thank you for coming. Thank you for joining us.